I'd like to thank our tremendous panelists, and I hope that someone's going to tweet the IA in illness is in isolation. The crucial letters in wellness are we. That's thank you to our panelists, and I want to share with you, we have about 15 minutes for a QA, and so that's going to give us about 3 questions-ish, depending on our moderator. So if you have a question, get to the mics as soon as you can, and I will pass the mic to Dr. Shanita Williams. She'll be moderating, and she, as you know, is the Chief of the Nursing Diversity and Development Branch in the Division of Nursing in the Bureau of Health Professions at HRSA. Dr. Williams.
Thank you, Patrick. So we will immediately open up the mics for questions. We want you to direct your questions to the panel regarding questions that you have about the federal investments that are being made in health disparities, in the social determinants of health, and diversifying the workforce. So if you have any questions, please signal by raising your hand. Patrick will find you, or approaching the mic. We've had a diverse panel, so there's opportunity for all kinds of questions, even the closing from the socialists to my far left.
Forgive me again to our sociologist. That's the last thing I want on a webcast.
Yeah, don't tweet that.
Yeah. Yes.
I'll get it rolling. Dr. Patchell, I have a question for you.
Could you?
I have a question for you, Dr. Patchell. I'll start it off then real quick. I was very intrigued by your comment regarding the fact that you were steered initially towards a 2-year community college associate degree. And I've looked at some of the statistics among African Americans who have baccalaureate preparation versus associate degree. It's almost pretty equal. But when you look at Native Americans and Hispanic, there is definitely lopsided towards 2-year associate degree. So I'd like for you to comment maybe a little bit more on that, and to maybe provide some suggestions from your vantage point on how we can sort of turn that tide.
Well, it's not everything's complex, but if you look at historically, the boarding schools were set up to train Native people to be service providers at the lowest level, and I think Hispanics fall into that as well. So the system, the education system, is geared to putting them into those levels and keeping them there. In my own tribe, when I was working with them as a recruiter, they had 100 nurses working in multiple clinics and hospitals, and there was 1 BSN nurse and 1 master's level nurse and 100 at the LPN, ADN level, and no mechanism for those nurses to get, because their question to me was, how do I get there? The biggest barrier was getting the prerequisites, because there's no funding for prerequisite work. And these are working people who are the primary source of income for their families. And so it's difficult for them, once they get into that, to get out. And so I had the advantage of someone at a top level, and that's why it's important for nurses who get advanced degrees to be in those positions, to be visible, because they're the ones that families will direct them to say, see what they say about it, and do what they say. And that's exactly what I was told, and that's what I did. And I was an adult out on my own, but when my parents said, do what she says, I did what she said. Just because that's how you do it. That's your elder. You honor what they say. And I think it's very similar with Hispanics. There's the fear that the higher educational system is going to break up the family, and that's, maybe Tony can say something different, but I think that it's that family and community focus is very strong in both of those, and not to negate it in the African American community, but I think the historical context is a little bit different for those groups.
Thank you, Dr. Patchell. We have 2 questions that were handed to me, and I'll go ahead and actually they can be read at the same time. So one is, because of medical apartheid and the legacy of experimentation on African Americans before, during, and post the Tuskegee experiments, many blacks and Native Americans will not participate in research or clinical trials. How can researchers recruit participants to do their research? Quote. The second question is in a similar vein. How can we encourage and urge more ethnic minorities to apply for NIH grants? Any ideas how they can be mentored in the process? Perhaps it was worthwhile reading those two questions together. Would you like me to repeat the question, or I'll pass it to Dr. Williams?
I'll just make a quick comment. You know, I've had the opportunity to be on several grant applications, and each time I was told by the research dean, I need to be the co-investigator, not the PI.
Wow.
So the reason you're not getting them is because they're not being allowed out of the system. Somebody has to sign off on those grants, and if that person's not willing to let a minority be the lead person on it, then they're not going to be.
Shobha, do you want to add comments?
I think the problem of recruitment and retention is there in a lot of underserved communities. And of course, the word that is used a lot is hard to reach populations. It's not that they are hard to reach, you're just finding it hard to reach them. They are where they've always been. My issue, the projects that have been, and this is from a personal opinion of grants that I hold and I have overseen for many, many years, is the grants that have been successful in trying to recruit and retain people and communities is when they have had very good community partners. You know a research project is good when even before the application was written, when the idea was germinated, there was a community partner in it. It had community buy-in. For example, in the Native American program announcement that I said we require your application to come in with a tribal agreement. It doesn't have it, it will not be reviewed. The data in that belongs to the tribe. Now, this is breaking away from NIH policy, please understand that. But this is also stating very clearly that this is a group that has had issues participating in research because data has been taken away from them for centuries and not given back to them. So this is to acknowledge that this data belongs to them. In the second question, getting about researchers, I think there's not that many, but there are a good amount of research-intensive institutions with minority institution programs, and there are also workshops that I think which should be promoted in a greater way, and it also depends on institutional change quite a bit. For example, what she said, she should be allowed to apply for an R03, R21, which are small grants. Maybe not a big one, but a small grant would be a good start. Thank you.
I think the emphasis on the notion of community engagement and empowerment and partnerships is really important, and certainly when we look at it through the lens of my office and the Office of Minority Health, that's really one of our core functions, is to have those partnerships and networks that if we are truly going to work to address disparities, and whether that's in research, whether that's in services, that there must be community engagement because they're trusted members of the community who can give the message in a culturally appropriate way, who understand some of the challenges and the obstacles, and can really inform the work that we're trying to do. So I think that model certainly is one that we recognize not only within the Office of Minority Health, but even as we move forward with a department-wide strategic plan, it recognizes that importance of community. It recognizes it in the Affordable Care Act, even when we look at the healthcare system, the importance of community. And so I think as we think about some of these legacy issues, we recognize this, for example, as we were doing our work in environmental justice, that you must have the community at the table informing what the challenges are, what the solutions are, and really empowering the community. And that includes in the research spectrum when you think about disproportionate exposures to environmental hazards and how that impacts health, is having the community at the table with a voice to really help inform from the beginning to the end of the work that's being done.
I was going to just focus on the issue of developing minority researchers, and I think we have models about how to do that. Again, I'm harkening back to the old days when we had the Health Services Research Institute, and it was I think a highly committed kind of program. So people came in for I think it was 2 years, and part of it was to hook them up with mentors in other institutions. Part of it was to hook them up to each other, which was actually an invaluable resource. And then the third component was to go through a whole series of mock grant reviews. So they would make proposals and they would be reviewed by each other as well as by people knowledgeable. And I think we have evidence that was actually quite successful. So we know how to do it. It's just a matter of getting something like that started again.
Good afternoon. My name is Kim Doe, and I'm here on behalf of the American College of Nurse Midwives. My comment is not directly related to research, but Dr. Patchell, you did inspire me with your presentation to make a point that I don't think has been made strong enough here, and that is that in nursing, we have these roots in treating the whole person, in holism, and that nursing is itself a distinct discipline. And I think that a lot of the conversation here, we've been talking about how do we, as healthcare providers, address these issues that are very important. But I want to acknowledge that in nursing and in midwifery, we bring to the table these values in treating the whole person. So,
Thank you. And I think that the holism in nursing it can also be a strong attraction to Native men to come into nursing, because many men practice medicine, practice healing. They just need a way to be recognized in an honorable way and not looked at as this little bitty piece over here that's just kind of a distraction, maybe.
I'm Diane Seibert. I'm here representing the National Organization of Nurse Practitioner Faculties, or NOF, and I'm also the program director of a family nurse practitioner program right in town here, Uniformed Services University, and all of our students are uniformed officers. It's a graduate school, and so therefore our student cohort is fairly diverse gender-wise, probably 40% male and 60% female, and also I would say probably 80% of them are prior enlisted. So they started out as that high school student that went into the military and then found nursing through a medical, technician kind of role, and then went to nursing. I look at their applications, and I've got probably 8 or 10 transcripts from various community colleges as they went to get various pieces of their education, and then they finished up somewhere and came to us. And so I have probably, of the 15 years I've been there, probably 275 graduates, and 15 of them have withdrawn. So it's not a large number of withdrawals, but of those 15, 11 are minority students. So I've been concerned about what it is about the graduate level education that creates barriers. I don't know if it's the fire hose of graduate full-time work that they're not prepared to deal with, and I have some concerns as we transform into the doctoral work that we add a third year and then more credits on top of students that are struggling to stay engaged and stay on track. So I just put that out there as any thoughts from the community about how to address the diversity at the advanced practice level when some of the students have trouble making it through that gate, the graduate level gate.
Well, I think that in the program I had, we did master's level nurse practitioner as well as undergraduate at first, and what I found was the master's level graduated, but they graduated sick, the native students. They graduated with lupus, they graduated with diabetes, they graduated with high blood pressure, all kinds of things. So the stress of graduate education is great, and part of that comes from the institutionalized version of, if you're a minority, you are not worthy. So this is where your mentors come in. Your mentors who have already gone through that gauntlet come in to help with that. So that would be my suggestion. And what I also used was acknowledgement of other things of self-care, because sometimes that message of self-care gets lost. And so there's a strong emphasis on self-care and ways of taking care of yourself so that you could then take care of others.
Anyone else?
I'm going to actually use this opportunity to make a comment about it. You said most of them are minority. My thing would be to look at, is it racism? Is it discrimination rather than race or ethnicity? I think that's a deeper question to ask. We tend to simplify it by saying race or ethnicity. I think we need to go deeper and say, was there racism? Was there discrimination? Because institutionalized racism and discrimination is very, very hard to measure and capture. But I think it needs to be captured, especially in this environment. We use race as a proxy for a lot of things, for poor, for underserved, for lack of education, for racism, for discrimination. We use it as a proxy. But I think we need to parse it out and measure it and talk about it in real depth. And I think that we have to come out with better innovative methods of doing it, whether it is for diversity in nursing or whether it is in research. I just don't mean to use you as an example, but I'm just saying that when we say minority, we have to clarify the point.
And I would agree with you. I think I would say our medical school colleagues struggle with some of the same issues when they look at the students that don't make it through. I would also have to say that I didn't count up the number of my quote-unquote minority students that have done very well in our program and would be what I would call rock stars. I'm not focusing on that cohort. So I don't think it's the curriculum being slanted in such a way that it makes it impossible for certain people to succeed in the curriculum. I just wonder if what I'm seeing at the graduate level is the consequence of those maybe students that come out of schools at the elementary school level that weren't preparing them for the fire hose because they didn't have to, they've never had education at this pace before. And I think there's a place in medical school education too where I've seen pieces of that, successful undergrads struggling in graduate school.
So I think if anything, you could probably bring that social determinants into the educational setting as well. We've been talking about it from the health disparities and healthcare, environment, public health, but you can bring it into the educational setting to say, what are the other factors? Is there social isolation, the mentorship, other pressures that are happening in addition to potentially the academic preparation and the academic achievement? And I think, for example, when you look at, that's the importance of why when you look at these White House initiatives, for example, on educational excellence, it's not just the Department of Education that's responsible for it. It's all of the federal agencies at the table to talk about housing and urban development, to talk about health, because all of these things can be interwoven into the reasons why students may or may not be able to successfully complete programs. It's certainly complex, but I think it's multifactorial. It certainly can be academic preparation, but there can be many other components to it, and not solely to minority populations, but also we've seen that certainly for women as well, and with regards to women who are in the biomedical sciences as researchers, et cetera. What is it that causes them to leave the profession? So I think there are many factors, and really trying to address that from the previous speaker's point, a holistic approach I think is really important.
Thank you. I think those were very provocative and thought-provoking comments and questions, and I hope that we continue to chew on them, but we're out of time. You're welcome to approach the podium and ask the speakers some additional questions, but we want these questions not to go poof. We want to meditate on them, and if they're hard, then that's good. It's good to think about difficult things. It's good to meditate on them and wonder, why is this so difficult? Why haven't we solved these issues yet? And that's part of what the challenge is, right? You're all big thinkers, else you wouldn't be here. So having challenging thoughts is a good thing. So I'll say that and turn it back over to Patrick. And can you please thank our panel one additional time?
Absolutely. I'd like to invite people, and they already have, stand up and acknowledge our phenomenal panel, from Dr. Williams to Dr. Gracia to Dr. Moore to Dr. Patchell to Dr. Srinivas, the sociologist. I'm never going to live that down. To Dr. Srinivasan. So thank you so much to our esteemed panel, and this has been a tremendous day. So thank you. While you're seated here, we'll go ahead and wrap up with the day. And what I'd like to share with you, before you stand up and start heading out or start the buzz in the room, the buzz. I hope you're leaving today with a sense of engagement, energy, with a sense of buzz, of that sense of transformation, empowerment, information, that you can take home and use in the work that you're doing, in the grant applications you're doing, in the day-to-day work that we're all doing in the trenches in our different disciplines, in our different ways. I spoke with one of the grantees who pointed out that they had much to share as well. The grantees you as grantees have a tremendous wealth of knowledge to share as well. That's in poster sessions, but that's also in the networking that's going on here. I understand that this conference doesn't happen very frequently. It's been several years. So as a supporter and an outsider, I would like to acknowledge what HRSA is doing in an era in which conferences are being canceled. This conference, it's nice to see some head nods, this conference is standing tall and is being presented because it's valuable, it's important, and that's something I want you to bear in mind. So this afternoon, now I'd like to see a show of hands. How many folks have already gone to the poster sessions? We didn't have that much time during lunch, right? You're right. It's about maybe 20%. I want to invite you to please. We have time dedicated for the poster sessions. These individuals, these groups have spent a good amount of time, a tremendous amount of time preparing the grant, preparing the poster session. So please, you have time. Who's gonna swing by and visit more posters on the way out? Really? Who's going to swing by and visit some posters on the way out? Please do. While you're out there, pick up a ballot to vote, because we're looking for a vote on the best poster. And there will be first, second, and third recognition. This is a government agency, so it's not like there's a prize here of monetary or financial, but there is certainly recognition, and we'll be announcing that tomorrow. So I certainly want to invite you to vote, and vote at least today. And I want to wish you safe passage on your journey home, whether that's you're staying here at the hotel or home further from here. And if you're coming back tomorrow, then we welcome you with open arms. For those of you who would only could come for just today, then is anyone coming here just for this one day? Well, okay. Well, I saw a hand go up over there, so I'd like our group to acknowledge. I'd like everyone to acknowledge you. And anyone else leaving? No? All right. So let's give her a round of applause, because we need to send her home with lots of energy. All right, folks. So have a wonderful evening. I'll see you in the poster session. The panelists are here. Please approach them and ask them your questions. Thank you so much.